we're also joined by Dr. Ross.
How's it going, Dr. Ross?
I am great. How are y'all doing?
Pretty good. It's been a very fulfilled day. Oh my gosh. Well, thank you for joining our podcast.
Yeah, I'm excited about it.
Yeah, a little nervous.
A little nervous.
Just a little. Well, first things first, what made you want to become a doctor?
Yeah, so, I mean, a lot of things. I think, one, growing up, I mean, we grew up in a house full of animals and then animals outside the house. I mean, we had dogs, cats, horses, guinea pigs, turtles, birds, gerbils, you name it, we had it. And so I've always been around animals my whole life. And, you know, I don't necessarily think that loving animals is the only reason to get into veterinary medicine. But I did know I wanted to spend my life with them, around them, you know, trying to help and do whatever I could. And so as I got older, realized I really loved the sciences, got very into medicine and that sort of thing in college, started working around vets, and then realized that that was what I wanted to do with the rest of my life. And so it was really the medicine that came in later that made me decide that was how I wanted to spend my life.
Your calling.
My calling, if you will.
That's good. That is
And then
cool.
she's a Georgia alumni, which is always good.
I am, but I'm going to say, like, you can hate me for it. There's a better Bulldogs, Mississippi State, and that was my undergrad, so that will always be my favorite.
I've said it on the podcast before, but that is why, like, school-wise, Dr. Ross is my favorite doctor, because she went to undergrad at Mississippi State,
Absolutely.
and she went to vet school at Georgia, which are my two favorite schools. Grew up a dog fan.
Mine too.
So,
No, absolutely. I'm always going to put Mississippi State first, but I am a Georgia fan, huge Georgia fan. Just like Mississippi State a little better.
Oh man, I don't even know. I don't think I've actually ever looked into it. I just know that this field felt nice. It felt right.
Yeah, I was gonna say, have y'all talked about how y'all got into this field yet? I'm sure you have.
I mean, I know I've told
Touched on
you.
it.
I've touched on it on the podcast
Yeah,
before. 'Cause
we've
basically,
touched on it.
I know me personally, I was very much a, I joke veterinary reject because I was going to be a DVM and doctor and all that stuff, and then I said nope.
No to the debt? No,
Yep.
yeah,
So,
that's fair.
then I was like, I'm gonna be a tech.
Understood. So, you got a new baby. Congratulations.
Thank you. Yes, I have a newborn at home. She's a little Cavalier King Charles Spaniel. I'm very excited.
What's her name?
So we are undecided. My husband and I have a very bad habit of waiting a long time to name a pet. So we kind of throw things around and then decide what sticks and what suits her. And so right now, we're kind of on to sorrel because it is another, I know, don't laugh at me. It is another tree that's in the same family as Willow, which is my dog that I lost last year. And then also a character in a book I loved and actually a color of horse that matches her color. So we're kind of on sorrel. I don't know if it's going to stick. It might be olive. It might be clover. It might be ivy. I mean, who is to say? So she's currently nameless or has like 6 names.
No, I like olive too, though.
I do
So many
too.
olives you meet.
You don't meet a lot. We're trying to do something that you don't see a whole lot, but it's, you know, I've had to shoot down a lot from my husband because he's like, I've never met one. I'm like, I've met 30, so no.
I like the Willow just because I'm a fan of like naming after other dogs I've had and stuff.
Really?
Want to keep it going?
Yeah.
So, because we a dog that I inherited essentially. He was my uncle's dog, my husky, and that was like my soul dog. But his full name was Sagona Gay. Everyone called him Sago, but it means blue in Cherokee because my uncle had a husky named Blue growing up.
Oh, I love that.
So
No, it's still
Honestly,
the same
I'm going to
definition.
be honest. I had a name picked out, like, before I met you guys. So I started here last July and lost my dog a couple months before that and had decided that her name, when I got her, before I renamed her Willow, was Lily. And so I thought it'd be a great nod to her to name this dog Lily. And
Until you came into
until I met
Military
Lily. No, but I just realized, I was like, I can't. Now I have a Lily in my life, and it's, I can't have a dog Lily and a friend Lily, tech Lily, so so that kind of,
some lilies.
ticked off the list. That was the original plan.
Not Lily. Got it. Well, so I know you have cats too.
Oh yeah, big cat girl.
Yeah. How long have you had them?
Yeah, so I got Eloise, actually when it was before vet school, when I was working in shelter med, and that was probably 9 years ago. 9 years ago, I said that not long. Yeah, so it was 9 years ago, and we did a TNR at the shelter, and I was going through and pulling the sheets off of the feral cat traps, and estimating the weights and getting drugs and everything for him, and I pulled a sheet up, and there was this cat. You could tell she wanted to be cute, but she was, I'm sorry, the worst upper respiratory infection. Honestly, I still think to this day I've ever seen. Like, could not open her eyes. They were like gummed shut. You could hear her. It was bad, and but she was meowing at me, and she wanted to come out, so I let her out, which is the number one rule. Like, never let the cat out of the cat trap. Like, they will trick you. Because the one time I did it, and the doctor I was working for got so mad at me, and I was like, look, she just wants a home.
She told me to.
And she told me, she asked me for it. And so I let her out, and I was like, this cat's not feral. And I asked the people when they came back to pick her up the next day, I was like, do you have a plan for this cat? And they said no, and I said, can I have her? And they said yes. So I told my sister and my roommate that I was gonna foster a cat for a couple days, and it was obviously a lie. Like, I had adopted her, she was in my name, but I was like, yeah, I did, because I was like, they need a meter, and it'll be fine.
We're getting
For the audience, foster does not exist for veterinary
No.
staff members.
Absolutely not.
If they're technician, reception, doctor, and they say you want to foster something, we will look at them and be like, all right, so and so has a new pet.
This is now yours.
Let's see. In the past, Naya, all your fosters have turned into your own pets.
Yep.
All fails.
Yep. Yep.
Mills is kind of a foster fail.
Mm-hmm.
Ross has now told
I
her
am a
foster fail story. Pretty much, yeah. Anyone who's rescued. Kayla was Fennel. Fennel's not really a foster fail. Kayla knew she was getting Fennel before she saw Fennel.
It was kind of forced on her with Fennel.
But no, like there was, Megan's got some foster fails. Like we all do.
It's so hard. You just can't.
Yeah.
They're already there.
Yeah.
I think the only fosters I have successfully fostered would be like I did some when I was at the shelter. I would do fostering for cat litters. You know, I never. And it's not that I don't love the bottle babies, but I really liked the litters with the mom, because you just take care of the mom. You get these babies, and it's wonderful. And I did want to keep all of them, and there were 4 babies, and I really wanted the mom, but it was. We did not. We found new homes for all of them, and that was so,
the one time
so
you don't
hard.
want it to work out, it
right.
worked out.
I was like, well, if we find homes, we'll rehome them, and they were super popular. So those are the only ones that we did not keep.
So I guess circling back around to something, because you did spend some time in shelter medicine, and I think, like, as in true shelter medicine, not just kind of like doing a stint in part of school and stuff. And so shelter medicine is such a different style compared to anything else in the veterinary world, because a lot of the times you're dealing with patients that are not the easiest to deal with. I mean, when you have a fractious cat that you're having to spay and all that stuff, and you're in there with the cat gloves just being like, all right, here's your dosage and everything. But like, talk a little bit about like, what did you love doing shelter medicine?
Yeah, so I mean, honestly, I loved it so much more than I thought I would. I really thought when I went to school, first I thought I was going to be a horse vet because I grew up riding horses, and I was like, yes, you know what, I want to do equine medicine. And the quality of life for large animal veterinarians, I mean, your work-life balance is And I can't say from experience, but from the people I know and just from going through school, that was kind of knocked off the table pretty quick. And then I was like, I'm going to do shelter medicine because I think the thing that I liked best was you felt like you were leaving and you had done good at the end of the day. And that is not to say that I don't feel that here. I do every day. You leave and you feel like you have done something positive. But I mean, the volume of pets we could help, if it's done right and if it's done well, we would maybe get sometimes 30 feral cats that would drop off during the day. None of it's scheduled, right? It's how many cats get trapped by these people when they bring them in. And you would see them go and you're like, yes, I know that I just helped with the population issue, because that's a huge thing with cats. I remember doing a demonstration with the vet I was working for. We had kids that would come in and do like a summer camp with us, and she started out and it was like 4 unfixed cats and went through every kitten season and kind of statistically with how many cats are in a litter and how often they tend to have litters and different things like that. If you weren't to spay and neuter them, how many would you end up with over the course of about 5 years? And I wish I could remember the exact number, but I mean, it was stupid high.
Jeez.
And it is such an important part of population control there. But two, I mean, you really seeing the ones that have been there for years and finally have someone come in and fall in love with them and get adopted. And actually my best friend I met in vet school, we were going back there and we were all sitting our first day of orientation and talking about our pets, and she starts talking about her cat that she got at the shelter I worked at, and I was like,
oh,
what, was he the lobby cat? And she was like, yes. And I go, I think I met you that day because he was my favorite cat there, and she came in and it turns out, yeah.
How do you take a lobby cat?
I know.
How do you take the main cat? How do you convince people I'm taking that one?
That's
Well,
mine.
the funny part about it is usually the lobby cat is one of the worst once they're outside the clinic.
Yeah, that's why they stay in the clinic. They're great.
Because that's how Emmy was. So we at Ackworth, and Dr. Ross, did you meet?
No, so I had actually
remember.
just been hired, and I was in the sling, and I saw someone post about Emmy, and I thought it was Megan's cat, so I text her, and I'm like, I am so sorry about your cat. She was not.
So Emmy was essentially a foster fail for the clinic. She had come before my time. She was there. This was back like opening of the clinic and stuff. We took her from some people who couldn't take care of her. Tried to foster her out. Some employees tried to take care of things. She acted like an angel inside the clinic. The second she left the clinic and went somewhere else, the stories I heard, she would make messes everywhere,
pillows.
tear up a house. Like she wanted to be in that
the
clinic.
clinic.
So that's what
I
she
like
did.
it here.
She would, and her daily routine was all of her stuff was in the bathroom. We'd leave the bathroom door open when nobody was in it. And stuff. And then she'd walk out.
She's coming in and out.
She'd walk all the way through treatment, through pharmacy. She'd get to admin, and we kept a bed in between the two computers and admin. She'd hop up on the chair, hop up in the bed. She'd spend most of the day at her bed in admin. And then right around like 4 or 5 o'clock, she'd get down. She'd start screaming at people, and then she'd head back to her bathroom. She had a routine, and she stayed out of your way.
She did. She did until you bring an aggressive dog back, and then she's like,
She wants to be a part of
how
that
are you
world."
doing? Who's this?
She wants to be like the second she heard an angry cat, aggressive dog, she's like, I gotta go check on my peeps here. But
Calm down. It's a great place.
but
You're
no,
fine.
she would, and even then, like she would just walk straight through treatment. I'd have a patient on the table, and I'm like, well, I guess Emmy's going to the bathroom or gotta get some food.
As long as he's on by.
She wouldn't hang out in treatment. She wouldn't hang out in pharmacy.
I mean, honestly, that's kind of
Like,
ideal.
it's like
It is.
She was the most ideal clinic cat.
She knew she was in the right place.
She knew where to
that's where
hang
I'm
out
supposed to be.
to where she wouldn't bother us. And then she was just there, and she was fantastic. And so so the day we had to put her down because she had cancer and everything, like we knew she had cancer for a long time, and we were just treating her, and she was
toughed
doing
it
really
out.
well.
She was great.
Yeah, and then she 16 was our guess.
Mm-hmm.
Yeah,
16,
16, 17.
Mm-hmm.
And then that week she just went downhill really quick.
Yeah.
But
I love a clinic cat. I'm not gonna lie. I want like petition for a new clinic cat.
We're trying.
I love that.
We have been trying.
I don't think we'll get one until the new building.
Probably.
I think.
No.
Any
Yeah.
like new adoptions though would be like, hey,
Heck,
they
come
want
on.
the cat. They can just
No.
raise it here.
We could convince a clinic cat for this location.
True.
Yeah.
That's true.
Oh, I think
For
so.
America.
Oh, we
For
should.
For
We
sure.
probably lose it, but
But I don't know. I feel like clinic cats, like, you don't find them, they find you.
Oh yeah.
You know, like, I feel like they just have
That's
to
exactly
come across
how
your
it
path
happens. Yeah.
and decide this is where they want to be.
yeah, you
You
can't
know,
take any
it's-
cat in.
They are a special breed.
Yeah.
My first clinic cat was Maine Coon.
Oh,
She's gorgeous.
Oh, I
She's
bet.
huge.
Oh, I want a Maine Coon. That's on the list. It's on the list.
I told Lily, I said if we get a cat and stuff, I said it has to be indoor outdoor.
Yeah.
Yeah.
Because I can't with the allergy stuff inside. Like,
I know.
sorry, I will not have a litter box inside my house.
I don't like litter boxes either.
Yeah, no.
See, I'm just like, I'm such a, y'all know, like, everyone's known me as, like, I'm more of a cat person than I feel like most at the clinic. You know, I feel like there's a couple of us that are up there that really like the cats, but I mean, y'all haven't seen me as a dog mom yet.
Nope.
I
Not
mean,
at all.
Oh, Kayla was laughing at me earlier today. She was like, "Oh, you're a crazy dog mom." And,
Oh,
and
no.
Elijah's seen me even when I
Oh,
brought my dog
no.
Brinken, and he was like, "You're not good at this."
She won't.
I won't poke
So,
him.
yeah, so when you have employees that bring their dogs in, it's either they're like me and they'll do everything. Like I
Same.
used to get my dog to sit on the table by himself and I draw blood without no assistance. Like that was me. And then you have Dr. Ross who will not take a needle near their own pet.
I will
I
be in the
apologize.
same
She-
area.
I won't. I
We
think-
were doing vaccines
Yeah.
and
Oh.
she did the rabies because
Yeah.
legally she has to. And then everything else she handed to us.
And the whole time I'm going, I'm sorry, which is ridiculous, you know, because it's like, it's not like I don't do this
She's
100
like, it's
times
just
a
bad.
day. And I'm doing it on other
And
pets.
Brink was just sitting there like,
He didn't
I don't
care.
really care what's going on.
He didn't care at all.
Oh.
I cared. I let him, he goes, "You're worse than Dr. Mills." And I was like, yeah, I know. I know.
Well, Dr. Mill's funny. She'll do like everything except give a Bordetella.
Bordetella for sure.
Bordetella
On
is the one
any
thing she like never
patient.
does. She'll
She's
just be like,
mm-mm. Here you
no, here.
Yep.
I'm gonna be honest, even not on my own pets, I don't like doing the Bordetella.
Bordetella.
I feel like I'm waterboarding them. They hate it.
It
I'm
feels
like,
so bad. They just stare at you.
Yeah, they
Why?
stare at you. Why would you do
What
this
is
to me?
this?
And I'm like, I'm so sorry.
Yeah, and you
It's
get that
not
aggressive.
fun.
But then you get that aggressive pet and it turns into a game.
Yeah, it does.
Can
it
I get
does.
you the Bordetella before you
Yeah.
maul my hand off? I had that the other day. I had a little Shih Tzu and everything. Nicest owners in the world. Dog is mean as can be, and they know it. And he comes in a carrier and stuff, and I managed to get the leash, and all I have to do is give this dog a Bordetella. That's it.
That's
He
all.
he didn't make it all the way out of the carrier. I just got his face to it, and I kind of shot from a distance, and I scored, and I was like, sweet,
Yeah,
awesome,
that's
you're done.
great. Get out
We're
of
done.
here.
Okay.
Good job, buddy.
Moving on.
Oh, I've seen both of y'all make some impressive. I'm like, if I can't get it, I pass it to you
There
guys.
we go.
I-
She got to witness, this would have been probably like a month or two ago, but it was here. She got to witness my leash trick on the muzzle.
I was actually
yeah.
about to talk about that because I was watching him and I was like, okay.
Yeah,
All right, I
right.
mean,
It's
he-
crazy.
It was that like
It's
60
crazy. You
pound-
would have never thought to
Yeah,
put
you
a
don't
leash on
know.
the slip lead on the
No.
mouth. It helps. Yeah.
No, you don't. And then I'm sitting there watching him and I'm like, well, look at you go.
Mhm.
That's a great idea.
It's just you lasso it and you go. I tried to do it the other day. Me and Nelson, our dog, and I did. That dog was.
Yeah, no.
Would
Some of
not
them can
have-
fight it off really well.
Yeah, but yeah, because I've witnessed it a lot. Like, and I always like to say this to aggressive dog owners that are so nervous about putting a muzzle on.
Mm-hmm.
The amount of dogs that I've seen just putting the muzzle on and they calm down
Mm-hmm.
Mhm.
is I will always talk
Party
about
hat.
that with an owner. Yeah, that's why I call him a party hat. Like,
They are. That's
They're
I
like,
used to.
"Alright."
I grew up with a German Shepherd who was, you know, in my eyes as a kid, I'm like, he's so sweet. He wouldn't hurt a fly. Like, this is the best dog in the whole world. Like, and we would have to put his party hat on to go to the vet, and it's, you know, it does make. I will say, like,
Take
vouch
you
for my
back.
parents. Like, he got his Trazodone and his gabapentin and his party hat and would show up to the vet. I mean, it was a whole thing. But as soon as you put his party hat on, he calmed
He
down.
was chill.
Yeah.
He did.
Yeah.
And I get it. Like,
I'm
from an
good.
owner perspective, it looks like a scary thing. What are you doing? And
Absolutely.
stuff. But
It's more to
but
get
no,
them out
my-
their head and realize, oh, okay. this isn't as
my
bad.
husky, like that dog would, if you looked at him wrong, he'd take
Oh,
someone's arm off
Oh,
Oh,
yeah.
yeah.
and everything. But the second I put a muzzle on him, he'd let me do anything in the world. Now
Oh,
I worked
man.
with that dog like every single day for 3 years straight inside of that clinic. Because we used to get, at my old clinic, we would bring our dogs to work every single
Yeah.
day.
Yeah.
I would put him on the table and I'd just start touching his feet.
Yeah. Good.
And it became, because
Get him
he was
used to it.
he was a, like, if you go to do a nail trim, he was going to try to take
Yeah.
your face off.
Oh, yeah.
So I would put him on the table, make him stand, and I would sit there and touch his feet.
That's
And I would
awesome.
look at him and be like, what are you going to do about it?
What
And
are
he
you
got
gonna
to
do?
the point where I got him when he was 7. By the time he was 9, I could trust that dog to do anything. But I worked
That's
with
awesome.
him every
Yeah, it was
single
great. He was a
day
good dog.
for
Well, that's
2
the most
years.
important
Yeah.
part
Yeah.
too. Is the working and conditioning and
Yeah.
all of that, desensitizing them to it. It makes
Big,
such a big, it makes a big difference.
yes.
It does.
It helps out a lot.
Oh my gosh.
What was it like going through vet school for you?
So maybe unpopular opinion, but I loved vet school. Like honestly, I always say if it was financially feasible, like I would be a professional student. I loved it. You know, I think that when I started vet school, my sister was in her, she was going into her 3rd year of law school at UGA, and I kind of seen from the other side, and obviously there are a lot of differences with vet school and law school, but I kind of seen from the other side as far as the time and just the mental toll it can take on you.
Yes.
I mean, honestly, it can, but I loved vet school. At the time, I was working at the shelter, and I loved that job, but I was ready to get in there. I was ready to learn, and I think I was just so excited that I had gotten in. You know, that I was like, this is great. This is going to be the best thing
Good
ever.
from here.
And I will say the first 2 years, like before you get to a lot of the practical stuff, to a lot of the like hands-on and really feel like, oh, this is medicine.
It is, yeah.
It's a lot. It's a lot of studying. Like there were definitely some mental breakdowns. there were several. There were several. But like clinics was I could have stayed on clinics forever. I loved it, and it was just a wonderful way to learn, because you would say I want to do a CT or I want to do an MRI, and then later that day you got the results, and then it was interpreted by a radiologist, or you were going straight into surgery, and it was like everything was right there. We had our lab upstairs. If we wanted to run something, we could run it. And I think the difference is by the time owners have gotten to that point with their pets, it's they know what they're getting into. You know, like if you're coming into internal medicine or neurology or something at UGA, like that's a tertiary referral center, right? And so you have gone to your
been worked up.
right,
Yeah.
like you've gone to your primary, you've gone probably to another referral center, you've
Right.
gone to places where this is really that they know what they're in for cost wise too. And so I mean, you could do whatever you needed, and that was what was so much fun about it, was that every problem you're like, we're doing this, the owners say yes, the patient would stay with you for however long they needed to, and it was very rewarding to see them get better, and it was a great learning opportunity there too. So I loved it. I was sad to leave vet school. I was sad to leave Athens. I loved it. I will say that like my husband would probably say that mentally, like, should I go through it again? Probably not. But and maybe looking back, it's like rose-colored glasses, and all of that. But I personally think I enjoyed it. I did.
I mean, as long as you have a positive outlook on it, that's what matters.
Like I wouldn't take the debt again, but I would do if someone was like, "Do you want to go back to clinics for a year?" I'd be like, "Yes." I would like that. I enjoyed it.
Okay.
So you are the baby doctor around here.
Yes, I am for sure the baby doctor.
Talk about, because I feel like for you it's a lot fresher than everyone else.
Yeah.
Talk about coming out of vet school and starting and just being like, whoa, this is probably much different.
Oh yeah, it's terrifying, right? So you come out and I mean, there are options, right? And I don't know if I know obviously you guys know this, but as far as, I mean, even before I really got into saying I want to be a vet, I'm in vet school, all of this stuff, I mean, you don't realize as a pet owner unless your pet has had a problem severe enough to have to go to a specialist. I mean, I still talk to clients and say, hey, I would recommend seeing a cardiologist, and they're like, oh, those exist for pets? And then, I mean, you have all the same specialties, right? And so you're in there in a situation where you have everything at your fingertips, and especially for someone like me who I think had a less conventional background before vet school. You know, most people do work in a GP. Most people have that experience firsthand before they come out. I go in with a lot of horse experience and a lot of shelter med experience to a GP where I don't have the resources that I had at school, and it is scary because sometimes you're going based off of, hey, what is financially feasible for the client, and that is absolutely reasonable because being in those shoes, I was like, look, I can only afford XYZ, and that is completely fair, but you are going based off of, you know, bits and pieces of information. You are making decisions, and no one's there to double check you and say, hey, maybe we do this, or maybe this is a better option. And I think the pace too, you know, like going into 30-minute, 45-minute appointments and doing that back to back throughout the day versus these are your 3 patients throughout the day. You have every resource at your disposal. Here are your 3 texts. What do you want to do? And here's the person who's going to catch you if you mess this up. Oh, man. That going into, you're interpreting this by yourself and having good mentorship, I think is one of the most important parts because, you know, in human medicine, you have to do residency. You know, if you don't get into a residency program, you are a doctor that can't practice essentially. And that's what I've learned watching, you know, my husband go through it. He's in his residency for human medicine. I always say human medicine.
Oh, he's a doctor, by the way, you guys. A human doctor.
He is a human doctor. And so in watching him go through that and seeing how much he learns even beyond those 4 years and knowing with veterinary medicine that there's really not an equivalent for someone going into GP to get that support. That's a lot.
It's just you get years of experience. I mean, we've talked about it with Nelson before. Nelson, out of all the doctors, has the most years of experience and everything. And it's funny just to listen to him talk about it and be like, I remember when I did my first one and what I was thinking back then compared to what I do now. And
it's a lot more laid back.
Well, not even that, because he, like, when you really talk to him, he's much more like, oh, I would do this, this, and this, and stuff, compared to back then, especially, like, in surgery. Like, I've seen Dr. Ross isn't the first baby doctor I've seen go through that and stuff, but surgery is very much a kick off the deep end. It's, you graduate, you have some surgical skills.
Oh, I'll tell you
and
after.
It's just, you graduate and it's all right.
Figure it out.
I will tell you, in school, your surgical skill, and this is, I think, pretty across the board, except for I know I've talked to Dr. Chase and that they did tend to get a lot more like spay-neuter experience where she went to school because they were a lot more, you know, stray pets and they needed help. They were able to practice, and that's wonderful. At UGA, you usually get you get a spay for a dog and a cat, you get a neuter for a dog and a cat, and you are sharing that with your lab group, which is 3 people. So you rotate who's going to be anesthesiologist, who's going to be assistant, and who's going to be like lead surgeon, right? And then before that, I think we had pigs where you would just do an incision and then you would close that, and then you would go in and do like an enterotomy, and then you would close that. And that's pretty much it. I mean, you're on clinics and you can assist. Like, you get to assist in a lot of things, but you are not primary outside of that. And so unless you get a good shelter medicine externship, which I did have one that was great, and I've talked to Dr. Mills, I know she had a lot of experience doing, like, I think it was a mission trip or something like that, where she got a lot of experience there. That's really all they offer at school is a 2 space, 2 neuters, 2 share for 3 people, and then doing a laparotomy incision. And so you come out and you need that mentorship, and it's something I think if for any new vets, like, advocate for it for yourself and say, hey, like, I want someone in here with me, even if you don't need the hands in there, saying, I just want someone to stand here and be a safety net, and if your new position doesn't offer that, it may not be the right one. You know, it's you having someone to back you up there and not having that panic moment is everything. And even having someone standing there and saying, yeah, that's what I would do, like, reinforcing that, because it's scary. You know, it is super scary when you first get out, and it gets better, but you need support. I think it's so important.
It plays a big role.
Because, like, I'm in surgery and stuff with Dr. Ross, but I've never done a spay. I don't have the practical knowledge to do a spay. I can assist.
It looks great.
I know my job. She's trusting me to do my job and keep that patient alive.
He does a wonderful job.
But as far as that goes, it totally makes sense and everything. But that's the good thing about coming here is because, so when Dr. Ross was hired, one of the big things she said is that she wanted to be mentored. And that was one of the big hiring points, is because Mills really wanted to mentor someone.
Yeah. And that
came at the right time.
I mean, honestly, and I tell her this all the time, is that I'm like, this changed my life. Like, honestly, finding this job, I was in a rough place when I found you guys, and I remember, I will say I adored the people at my old job, but there were things.
Yeah, the way they moved just wasn't
it
with
was
you.
not with me, and it was, I wanted someone who, what they wanted to do as mentor. I wanted to learn from someone who was one of the best, or, I wanted to learn from the best GP I could find, because that's what I want to do. I want to do general practice, I want to be great at it. And when I interviewed at Mills, I was telling her that, and she was like, I want someone to mentor. And I was like, I want someone to mentor me. And
it's happening right now.
And I think for so many reasons, I mean, the staff is incredible. I remember coming in and y'all like, oh, you don't need to do that. You don't need to do that. I was like, you guys are really good at this.
Yeah. She was quiet. She was so quiet and would move at her own speed and walk past us, and we're like, what's happening?
What's going on with her?
What do you want the room? We got it. Put it down. We got it.
You're fine.
She's like, I just want to, no.
No, don't do that.
Don't put in your notes.
I remember you looking at me going, that's not your job.
Yeah.
But I think that's an important part too, is like, yes, the mentorship, but like the technicians, the support staff. I mean, that is, in my opinion, the most important part. Like, you tell a doctor to go to a room by themselves with no technician, and you tell them to do a nail trim, you tell I'm telling you, it doesn't run without y'all,
That's why I laugh when an owner's like, I want the doctor to draw blood. I'm like, that doctor hasn't drawn blood in
you can watch.
They're way out of practice right now, I promise
You're like, I've done it
really
5
rusty.
times already today, just trust me.
It's always funny. Now, every single time, I will grab the doctor and have the doctor draw blood. But it's always funny because I used to work with the doctor, and I specifically remember she had known this owner for a really long time. And the owner was like, oh, I want you to put in the catheter. And the doctor looked at her and said, you don't.
You don't.
You don't.
Not wrong. Not wrong.
Yeah.
What is your least favorite surgery, though?
No, and maybe some people wouldn't technically consider it surgery, but a bad dental extraction, if there is a broken root in there,
It's dental. Yes.
They're rough.
Veterinarians hate dental work. None of them went to school to be dentists.
No.
The problem is that, I mean, yes, there is dental specialists and veterinary medicine, but they are few and far between.
Few and far between, and they went to vets. There is not a veterinary dental school.
No.
Right? Like, there are programs, there are, you know...
It's in passing.
Exactly. You can
Yep.
specialize the way you would as a neurologist or cardiologist. You did not go to school for 4 years to be a dentist. You went to school for 4 years to be a vet. And that, I think people forget, it's an umbrella. It's, when I talk to my husband about dental stuff, and he'll be like, I'm sorry, I'm just going to stop you right there. Like, I don't do that. Like, if I see you know what I mean? Like, if I see someone that, you know, the primary root, you know, the root cause is something dental.
Yes.
Yeah, they go deal with that.
Yeah,
And then they come back to me.
Man, when I tell you, it messed me up growing up, because I've shadowed in the field at 15, started at 16. And seeing you guys do dental and everything under your belt and everything, I'm like, okay, cool. And then going into the real world as an adult, I'm like, oh, so I got to go to OBGYN? Oh, you don't do that? Okay.
Yeah.
Got it.
No, but like that's the thing. So we've talked all the time about how techs and stuff, like we're radiology techs, we're dental techs, all that stuff. But it's the doctors too. Like
Right.
I've watched every single doctor here. They'll walk into a room as a GP, and the next thing you know, they're having to put their cardiologist hat on, or they're having to put on like their internal medicine hat, or something like that. Like they have to have.
Or ophthalmology. That's always a doozy.
But they have to have such a broad knowledge. Like, yes, they're specialists. Yes, people have focused on things. And it's kind of like Dr. Ross said, like, if your pet gets elevated out of a GP to a specialist, there is something very severe probably going on.
Absolutely.
Now, have I met vets that are very much just like I'm going to turf off to specialists all the time? Yes.
Referral.
Right.
But most GPs, like,
They're like,
everything's
I can do
done
it,
under one roof.
Yeah.
Oh, yeah. And I think, too, though, I don't want to say that we're spoiled here, but, like, I mean, we are. And I think something that's really neat is each doctor is kind of allowed to say, this is my thing. I want to learn how to do this thing. I want to get better at this thing. And that is supported. You know, we are going to continuing education. We're doing the wet labs. We're doing all this stuff to be able to offer those things in-house. And that's, you know, even with Dr. Mills, with her doing echoes and everything, and she has been trained to do that. And that is such a benefit for our heart patients that do not have to wait for a cardiology appointment.
And they also don't have to go spend specialist
Oh,
money.
yeah. Saves
Like-
them a lot of money.
Like, that's the big thing that I enjoy is we're building this in-house of network of specialists, but we're not having to go charge an arm and a leg to do it.
Absolutely. And it is the quality of the care and the diagnostics. And I think too that it's so hard when you are recommending things and it's oh, that's a lot of money, that's this, and it's like it is, but this is information we needed, and it is just, it's important, you know.
I think if it's more like I don't want to say like a controlling thing, but I think of it more as like a safety thing where you guys are so connected to that one patient, and then that heightens you to learn ultrasound, and you're like, I can't send them away. I want to know what's happening. I want to be the one who heals him and brings them back to this world fine. So I think it's also not only to help save the money, unless it's needed to be referred, but also I want to be hands-on. This is my baby now.
And that's, I mean, I think the thing too is that, you know, I always, when we get to a point in a case where it's, look, this is something we can do here, and this is something that there is a specialist for. And I will say 9 times out of 10, they want to stay. They want to stay with their, you know, with their primary vet. They want to do that. But I always make sure people know, because like we were saying, sometimes they don't know, you know, and so you tell them, hey, there's a neurologist out here, or hey, there's a cardiologist out here, and you give them the information. But being able to do that for your patients, it's ideally we would be, and we do, I think, offer the best care here, and to a point where, okay, this has now exceeded our diagnostic capability, where you know, we don't have a CT yet, or an MRI.
Yes.
You know, obviously go. We don't have a scope right now.
Yes.
Okay, yes, go.
We're gonna do
or
what's
if
best.
this is something where you're sitting there and you're like, I am stumped and I have called people and I have done XYZ, yes, go. I always give it as an option, but I will say most people want to stay because they know us, they trust us, they know their texts, they request certain texts, you know, they are part of the family at some point.
They are. I will say the doctors here truly do care. I've never really experienced morning meetings, period, but at every morning meeting, one of you guys always say, have you guys called so-and-so to see how they did at the ER? Or see what happened to the referral?
Oh, we do. It keeps me up at night. I will be laying there and it'll be 1 a.m. and I'll like sit up and I'll look at my husband and I'm like, do you think he's doing okay? I don't know who you're talking about. But you do. I mean, your heart, you think about them and what could we have done? They stay in your
I've
heart
caught myself
on
doing
your
that.
mind.
We'll like send someone to a 24-hour clinic on a weekend because obviously we're not open 24 hours and some do require that care. And then I'll find myself Monday walk in and be like, I should check on that patient.
Yep.
Not only just to see if they're coming back, because we do a hospitalization transfer that is nice prepared, but just hey, did we do our job well enough getting them to them and taking care of them that they are still going?
Yeah,
absolutely.
Even the ones that come in for rechecks and everything, I love telling them like, hey, I love seeing them like this. That means we're doing the right things for your
That's
baby.
the most rewarding part.
One of the best the other day, and I won't say the patient name, Moran's Addisonian dog.
Oh my gosh.
So the backstory on this dog and stuff, call him Fluffy, the classic dog name. He is a 90-pound dog. Came to us completely lateral.
Yeah.
Like
Addisonian
not moving.
crisis.
Yeah, we didn't know it was Addison's at the time. Long kind of diagnostic process that I won't fully go into, but essentially we got cortisol level, all that stuff, and realized, hey, he has Addison's disease. And Addison's disease and stuff is something that you can treat.
Absolutely. Very manageable.
Steroid treatment, very manageable, but this dog went being completely lateral. I had his recheck last week, and I walk into room 3 at Ackworth, and that dog runs over to the door. He's so playful. The owner was so happy because their dogs, he's playing at home. He went from being completely lateral to now he is back playing at home, and it was literally one of the rooms where I just walked in and I couldn't help but just grin from ear to ear. I was so happy to see that. Yes, we have our ear infections and all stuff, but those are just the dogs have fine. They should have
we see this all the time. They're great.
But cases like this where that dog was on death's door.
And the owners, I remember, thought, look, is there anything we can do? Are we going to have quality of life?
We were having quality of life conversations. To now, when the owner told me he is playing at home and everything, and I could just tell he was so happy. I was like, that is amazing.
And I will say, I'm glad you brought up that case, because when I was in school, our endocrinologist, she was talking about, we had a whole endocrinology course, and she started out by saying, these patients, when they're in crisis, will present to you as the most down and out. The owners are going to think they're coming in for euthanasia. They will present as some of the sickest patients, but it is also one of the most rewarding things to manage, because, and not all of them, right? That is not a cut and dry, we're not talking about cases where you have XYZ at play and all of that, but saying something, and she brought up Addisonian dogs, and she was like, these dogs are going to present to you so sick. And their owners are going to think that there's nothing they can do. They're going to come in talking to euthanasia, and if you just say, hey, let's test for this, let's see, and you educate them in what needs to be done, should that be the diagnosis, that it is. She said that's why she got into that subspecialty, because it is the most rewarding thing in the world to see them turn around and be like, we fixed that. This was a dog that we were at the point of considering euthanasia, from the client's perspective, and saying, hey, no, this is something this is something we can manage. This is something we can do, and it is. They are some of the most rewarding cases. I completely agree.
Especially the ones that remember you.
Oh
they
my
come
gosh.
running up to you and everything like,
when he came running up to me in the room, it was just like pet me and he'd love
Oh, I love
and
that.
everything. Oh, that was one of the few moments and everything, because I'm one of those techs. I can be very like stoic.
Mm-hmm.
Oh yeah.
I'm just like
Yes.
and that was one of those moments where I was just so like happy in the room and everything like that. Like
I love that.
stuff.
On those very like straining mentally, physically days, how do you wind down at home?
Well,
Do you think that's
no,
right?
honestly, I'm a big reader. You know, I probably read at least 10 books a month. Like it's like I'm a big reader, and so I have to be able to compartmentalize. You know, and to say I don't go home and think about that case or that euthanasia and that family, and you know, you carry that with you, but. I like to read. I go spend time with my sister, spend time with my husband. Now I have a puppy, and I'm going to spend time with her too. And that used to be my thing with Willow, was we would just go out and I'd be like, where are we going? And we would just wander. We'd walk, and I would put my headphones on, listen to my book on tape, and we would just do our thing. And then I also am a big crafter.
Oh yes, that's
big
right.
crafter. I used to go, I told you, I used to, before I left my old job, I would go to, my thing was, if I had the worst day, I would go to Hobby Lobby or Michael's, but the lobby's where it's at, and I would go and I would walk through Hobby Lobby, and I would just, I'm serious, it's so silly. I would just go through and be like, what craft are we gonna do? What are we gonna do? And I would spend like an hour and a half in Hobby Lobby.
Like, what did she
would
do?
call me, be like, I looked up your location. Was it a rough day? I'm like, yeah.
Aww.
Yeah, it was. But yeah, that's pretty much it. I would say big things are reading and spending time with my husband and my sister, and she's always there when I'm talking to her about stuff, and she does not know medicine, but she'll be there. She's in my
makes it
corner.
well
Tell you
enough.
what, she's in my corner about it.
She entertains it.
She does.
Yeah.
She does. She does her best.
Yeah, because decompression from this job is definitely an important thing. I know we're planning a mental health episode and stuff, mental health month and everything, but it's something that we've talked about multiple times of how
It can be a tool.
yeah, how much of a toll this job can take, and so having a way to decompress and get your mind off it and everything, like it's one reason that like. And Naya's a tech that knows me very well. Like, she can tell when I've had a rough day. Not because I show it, it's because I'm not.
Yeah.
It's because I will walk around just with straight face, just doing the job, doing it and everything. And I will just walk around and everything and just act like nothing
I'd be like,
is
your
going
energy
on.
is off. What's happening?
So,
buddy?
Yeah, but you catch that.
Yeah.
You always catch that. You are.
But,
Very observant.
So having a way to decompress is always really nice.
But I think too, being around people
Yes.
who, one, recognize and acknowledge it, but two, care. You know what I mean?
Exactly.
They care. We all just want
Exactly.
everyone else to be okay and do good. And it is hard because you have to compartmentalize, and I think that almost sounds harsh sometimes, and it's not meant that way, because yes, you compartmentalize, but do I still go home and think about those patients? Like, absolutely. You know, it's do I go home and think about them and worry about them?
Yeah.
Yes. But you have to let yourself off the hook and be like, hey, I'm gonna focus my energy here, because you cannot show up to work the next day and continue to do good for those patients if you don't give yourself a break.
And it's not even showing up the next day sometimes, it's doing the next 30 minutes.
Yeah,
Right.
absolutely.
So, I guess two things kind of bouncing off that. One, this is human medicine, but have y'all watched, I know me and Dr. Ross have talked about it, but oh my gosh, I can't think of what the show's called right now.
What
The
is
new ER drama.
The Pit.
The Pit, yeah.
Yes.
Oh, I've
where
seen trailers.
Every episode is an hour of this one shift they're doing.
Okay.
And it's the workflow in it. Like, they are just going, bouncing back and forth, and that's what
We
do
could literally
too.
have our
Yeah.
own.
And I saw a post the other day from a fellow tech and stuff, just on Facebook, and she kind of just took you through the workflow of her day. And it very much was a start with a cute puppy annual, instantly go into very sad euthanasia. Hospitalized patient wasn't doing well, started crashing, had to go save that. Instantly into another annual that you've got to be
Put on the
cheerful and
face.
happy and going and
yes.
hey guys, how's it going? And then instantly I forgot where her day went, but it was like that, like just the bouncing around. It made me think of the show because I've been watching the show and stuff. But it's very much we have to be able to change our mindset every single second, every single minute, depending on what we're doing and stuff, especially in vet med.
A little mentally unstable, but we love it.
In the best way.
Yes.
But no, I mean, and that's the thing, like, coming out of it, and everyone knows a tough euthanasia, like, the one, and they get you, and then about 5 minutes later, you're going in, and someone's bringing their new puppy, like, literally me bringing in, Sorrel, Ivy Clover, whatever her name is, and being like, this is the happiest I've been in a year and a half, and you're just coming out of, like, someone's emotional trauma, and it's you feel that, and you hold that, and so having to go on and put on a happy face and go in and be like, this is awesome. That's hard. It is, and I think it's something that's overlooked sometimes. It's tough.
It really is.
But it's also
So
rewarding.
I know there's some people that'll say they would rather begin their day with a puppy and like end their day on a bad note. Like if there's gonna be a bad note during the day, end on a bad note because they don't want to have to readjust. I can't. I'd rather start the day on a bad note than the day on a good note.
Yeah,
I would too. I want to leave ideally on and up.
Yeah.
There's nothing worse than leaving after some trauma.
Now you think about everything.
Let me go marinate on this
right.
I can always tell how I finished the day before with how I wake up the next morning.
Oh, yeah, absolutely. I can see
if
that.
I wake up and I'm just like, nope, like I'm dead, I can't get out, like I knew I finished the day before bad. But if I wake up and it's like, hey guys, like I'm up, ready to go, all that stuff, I finished the day before pretty well.
Yeah. Okay. I know, I'm the same way. I want to finish on a high note.
Yeah.
I want to finish
that's crazy.
Yeah.
That's kind of bad.
Are you, what, would you rather have it known in bad?
No. It's like somebody's crazy for that one.
I don't know who that
is. What is your craziest story?
Like ever or just in vet med?
Something that you just can't forget and you're like, why?
Oh my gosh. A lot. Like is it a vet med story? We're gonna cut this part out because I need to figure out what my story is.
Yes, that's
okay. Because I was like crazy.
It could be like going through school and something happened during school, or it can be like you finally were put out into the field. And you're like, oh.
I didn't think about it.
That's fine.
We'll come back to that.
Yeah, but we're gonna have to cut all that out.
Or just leave it in there.
It could be a little.
I don't know.
Actually,
I need to think on that.
We'll come back to that on another episode. So be ready the next time we have.
Yeah, like I need to think on that. There's been some crazy. There's been a lot of crazy stories, but yeah, we'll come back.
Okay, we'll circle back around. What is your favorite animal overall, though?
Like species or breed? Horse. I know.
I was waiting for it.
I know. I'm such a horse girl. I really am. Like, I do. I love them. Second to that is a dog or cat.
Really?
I don't know.
Okay.
It's one of the two. It depends on the day. Probably dog because my cats are kind of unkind.
Losing right now. Convincing me. I don't like cats
horse for sure.
Okay, I can see horses being your thing.
Oh, for sure. We're not all crazy. I mean, we are just like a little bit. It's varying degrees.
Well, I hate to wrap it up. We are running a little bit on time and everything. But this has been Getting to Know Dr. Ross on the Dog House with Mills Animal Hospital. Thank y'all so much for joining us. Please follow us on all of our socials. Please don't let me miss one, Naya, but we've got Facebook, Instagram, YouTube.
What's the Apple? Podcast.
The podcast is on Apple Music,
Yes.
Spotify now. It's on Spotify now.
That's
Or at least,
exciting.
yes, I have to double check that everything got uploaded. Everything's on Spotify. Should be on Spotify. It's on YouTube. It's on Podbean.
Yeah.
It is on Amazon Music, and it is on iHeartRadio, and everything. So please give us a listen. Thank y'all so much, and we'll see you next time.
Yay.